everybody. It's Dr. Kevin Usry coming to you from All American Wellness Center. Today, this is our very first podcast. We're very excited to talk to you about all about health and wellness. And interestingly enough, on our way over, we were wondering what we were going to talk about. We have many subjects we want to discuss, but we got into a car accident. So as fate has intervened, we've decided to talk about car accidents and all the things you need to know from the time you get into the car accident to the time you come into All American Wellness Center. We're located just south of North Palm Beach, right around Palm Beach Gardens, north of West Palm Beach. We're at 561-863-8779. We're going to be doing these podcasts every week. You can catch us on Spotify, you can catch us on Apple, and you can catch us on YouTube, and it will be titled All About Health and Wellness. So let's go on and introduce my manager of the office, Heather Klein. So without Heather's presence in the office, we wouldn't have the fantastic office that we do. She is really the nuts and bolts of this clinic. I work there as the doctor. We all work for her, my physician's assistants and myself, and Heather runs the show. So without further ado, let me introduce you to Heather Klein.
Hi, great to be here. I'm Heather Klein.
Well, short and sweet. So let's go ahead and talk about accidents. As a matter of fact, today, as I said, we were in an accident. We were on I-95. By the time I was able to pull over from the left lane to the right side, the driver who hit us was gone. And this is not an uncommon scenario. So, of course, as good citizens, we notified Florida Highway Patrol. We notified my insurance company. And now we can start the whole ball rolling about getting better. Right now, I'm starting to notice a bit of back pain. Heather may be feeling some of the same types of issues. And this is frequently what happens for the lucky people that are involved in a high-speed car accident and no serious injuries occur, but maybe some mechanical problems are happening that have a tendency to get worse over time. When you are in a car accident, a couple of different scenarios can occur. Number one, you can be seriously hurt where the experts in the field, the police and the paramedics come and attend to your issues and determine you need to go to the emergency room. And when that kind of scenario is occurring, you need to listen to the experts and, in fact, go to the emergency room. The concern at that point is, do you have a life-threatening injury? And that is what the emergency room is all about. Ruling out you have something that could possibly affect your life in a detrimental way where you could die. And it doesn't take very long for them to figure that out and to know that, no, you really don't have a life-threatening injury. They'll do some diagnostic imaging. They'll do some examination. Usually they send you home with medications, and you're still in pain. You're still having dysfunction. This is the time you go to All American Wellness Center. You call us at 561-863-8779. And by Florida law, you only have 2 weeks to get that done. So you make an appointment right away. And a lot of people are concerned, do I call my lawyer? Do I call my doctor? When you're injured, the number one thing you want to ensure is that you get better. And these soft tissue injuries many times cause scar tissue. If they're not handled properly, they can cause issues that affect your neurological function. Again, if they're not handled specifically and carefully, and this is what All American Wellness is all about. We use special techniques to help the impact that the accident injury has had on the brain. We get you out of pain very quickly. We don't have to use opioids or any type of pain medications. We have many different specialized techniques that will get rid of your pain right away. And we're there from the standpoint of helping you while you're dealing with your pain and your acute injuries, all the way to the point where we bring you to now just making sure that you're still mechanically working properly and that you're not going to develop long-term issues such as arthritis and degenerative joint disease, which is so common when someone's been in a car accident and they don't complete their care.
So when somebody is involved in an auto accident, what would you say their first step is when they get into All American Wellness Center?
Well, of course, we want to find out in detail what happened. How did you get into that accident? What happened afterwards? Were you told to go to the emergency room? Did you see someone in the emergency room? If not, then we start a thorough orthopedic, neurological, and chiropractic examination. When you're in a chiropractic office, it's all about function. Most of people's pain comes from the initial trauma, of course, but it comes from dysfunction. And if that dysfunction mechanically isn't addressed specifically and properly, it gets worse and worse over time. Scar tissue starts to formulate, and that can be a permanent problem.
Okay. So when somebody sits down with you and they go through what happened in the accident, after that orthopedic and neurologic examination, what should they expect? Do they expect to be adjusted? If you've never gone to a chiropractor, you're kind of like, "Whoa, what is this? What am I doing here?" So,
Good
I think
question.
people should have a little bit more of a detailed idea of what they're getting into.
Well, basically, when we're looking for dysfunction, I'm going to ask you to do certain things. If you can do them, great. If you can't do them, that's where the word dysfunction comes into play. I ask you to do something, you can't do it. Either it's too painful or you're just not able to do it. After we finish the examination, we send you off for diagnostic imaging. So we take films of your neck, your back, the rest of your spine, and I go over those films with you to show you where injuries and issues have occurred. Then we start you with therapies. The therapies are very gentle. They're state of the art therapies for the conditions that are so frequent when you're involved in an automobile injury. When you come into a chiropractor's office, very often the disc, the small cartilage pads between each of those 33 bones in your spine have been damaged. So we start you on something that frankly most people fall asleep on. It's so comfortable. We use laser therapy and decompression, and this is what goes right to the heart of the matter and addresses those issues right away. When people are adjusted, we use an instrument. It's quite comfortable. I make sure that they feel it with their hand first. They're very comfortable. It's very important in that office from the time you walk in the door and meet Heather to the time you meet me and deal with Paul and Terry. You're going to feel comfortable because we've been doing this for a very long time. We're highly trained and we're very compassionate about the things that you're going through. It's scary when you go to a doctor for the first time. We're well aware of it. Our place looks like a house, so it's like you're going to your house. It's like going to a home environment where your family is there to take good care of you. And as I said, the instrument adjusting is totally comfortable. And once people get to know our staff and know the team, they start telling us of other things that they were dealing with before the car accident. Oh, I hadn't been sleeping well before I got in the car accident. Oh, I had indigestion all the time before I got in the car accident. Oh, my fatigue was awful. I wasn't able to do a lot of things before the car accident. So sharing with us gives us the ability to deal with a lot of dysfunction that plagues most Americans. Many of the things they deal with on day-to-day issues is as a result of dysfunction. And when you're having these dysfunctional issues, they impact your lifestyle. So we're there to treat them from the beginning to the end of their need for care.
I think that was a pretty great answer, really straightforward. Do you think that this is something people should prepare to spend hours with you per week? Should they make sure there's a special regimen that they need to follow after seeing you for the first few times?
Well, when they're initially hurt, we usually, the first time they're with me about an hour. We have to do the exam, we have to get the x-rays done, we do the therapies, the adjustments, and then they're out within an hour. Follow-up visits are usually about 30 minutes long. They're very similar to going to physical therapy, going to a gym. When you're trying to make changes in your body, regular care, regular attendance is important. So usually 3 times a week. We'll do that for a few weeks, anywhere from 2 to 3 weeks. We follow up with another examination to see how the person has been progressing. If they're progressing well, perfect. We'll continue with that same schedule and continue slowly giving them more things to do, such as range of motion exercises, some stretching. If they're not doing well and we suspect that the discs may be seriously injured, we send them out to one of the premier diagnostic imaging centers that we use to get the MRI, the magnetic resonance image, which tells us what's going on specifically with the disc. We also will send them to one of the premier orthopedic centers in Palm Beach County. We use Roush Spine. Dr. Thomas Roush is an excellent orthopedic surgeon, and I couldn't give him a better recommendation. Whenever there's invasive care that's needed, he is the person I choose to send my patients to, and I couldn't think of a better recommendation than that. Now let's get to the lawyer. Everybody is so concerned about what blankety blank law firm got for them. Ladies and gentlemen, insurance companies don't blatantly give you money. When someone gets a large amount of a settlement, they've been seriously hurt and will have to deal with those injuries the rest of their lives. My hope for the patient, number one, is that they get better. They're able to forget about this terrible incident that interrupted their lives. But my biggest concern is, yes, that they get better and don't carry this with them the rest of their lives. After that, they can always get an attorney. There is no rush to get an attorney, but when you do, you want to get the best. We deal with some of the best law firms in Palm Beach County. We deal with Lytle and Ryder, we deal with Gordon and Partners, we deal with the Drucker Law Firm, just to name a few, and they have been in the business of personal injury for years and years, and they're professional, and they're very, very good at what they do. So it's kind of a one-stop shop. If you need more invasive care, we'll send you there. If you need an attorney, we'll send you there. We like the people that we work with because they are professional and they do an excellent job.
So, the number 2 question I'm going to say people are going to ask is, what does it cost? And how long is it going to take me to start feeling better?
That's a good question. Usually within a week, the patient is starting to feel better. It does take a little time for the therapies, the adjustive procedures, some of the special procedures that we use in the office. Many times the patients leave without having any pain at all. How long does it take? Depending on how serious the injury is, if the spinal discs have not been involved, you're usually looking at somewhere around 8 weeks. The person is able to go back to their normal activities. They feel really good during that time. We also address a number of the other issues that were affecting the person to begin with, helping that indigestive issue, helping those problems with headaches and fatigue, helping those problems with sleep issues, and many times a lot of functional mental health issues come to play when we're treating people. They start feeling more comfortable with us and tell us those things they're maybe a little ashamed or embarrassed to talk about. But most of those functional mental health issues have a lot to do with their biochemistry. And just tweaking a little biochemistry here and there, they're able to start feeling that sense of well-being once again. And if you're having to look at a silver lining in the dark cloud of an auto accident that brought you in, there's something positive that occurs almost every time someone comes to our office. How long will it take? If it's a disc injury, could take up to 3 months. And again, after that 3-month period of time, that patient leaves and no longer is dealing with those injuries that were incapacitating them.
Great. And what's it going to cost? Because everybody is going to ask,
like
what is this going to
that?
cost me?
Well, back to what I was originally telling you, you want to get into the chiropractic office at All American Wellness within 2 weeks of the accident. Your insurance company covers that. They pay for your care. You've been paying your premiums every month, and this is where the other side of the relationship comes in. They will take care of you. They will pay for reasonable treatment at a chiropractic office, at an orthopedic office, for your diagnostic imaging. They pay for all of that. This is why it's so important to have insurance and follow the rules. Get into the doctor's office within 2 weeks of having your automobile injury, and you don't really have to come up with anything out of your pocket. And many times the patients are glad that they got in right away because their injuries heal faster. We're not having to deal with a lot of inflammatory problems that occur when you delay your treatment. don't delay. By all means, don't delay. Get in and get your problems taken care of.
I think that really answers a lot of questions about car accidents because, when you get hit, you're frazzled. You have no idea what you should be doing, what it's going to cost you, fixing the car, getting to a place, calling the emergency room. So I think you really answered a lot of the things that people want to know.
Well, I'm smiling because, as I told the audience to begin with, we came here and on the way down we got into a car accident. And yes, all those things are on my mind. And as we're talking, my back is becoming very uncomfortable. So I know I'm going to have to go to All American Wellness and get some treatment there. And as it is, I'm glad that I have that center that I can go to and get all of the care that I need.
Pretty ironic to get in a car accident, coming to a place to talk about a car accident.
Ironic is true. Ironic is true.
Well, at least we know where to go.
All American Wellness. Did I mention that?
All American Wellness.
863-8779, area code 561. Give us a call. We're at allamericanwellness.com. Look at our website. See if you feel comfortable coming to our facility. Whether you've been in a car accident or not, we offer a free 15-minute evaluation. If you're not sure whether you should go to the medical doctor or go to the chiropractor, go to the chiropractor first. We're gonna give you a thorough exam, and we are trained to tell you whether you have disease and pathology. If you have disease and pathology, we'll refer you to a medical doctor so that you can get the appropriate care. If you have functional problems and you're in our office, well, you're in the right place to be. Chiropractic treats functional issues. And if we see that you have something more serious in the way of disease and pathology, we have a whole array of physicians that we refer to who can give you fine care.
Well said.
Did I mention 561-863-8779? Give us a call. Get a free 15-minute evaluation. You won't be sorry you did, if for nothing else than peace of mind.
And Dr. Usser, where can the people find you on the social media?
Well, on Spotify, on Apple, and on YouTube. Just look for All About Health and Wellness. We're there. We're going to be there regularly every week, and we're going to cover a whole array of different subjects. Today it's auto accidents. Maybe on the next time we talk, we're going to talk about the kids in crisis. There's a lot of mental health issues that are affecting children nowadays, anywhere from 10 to 24. Some of the statistics are really sad and shocking. And a lot of it is occurring because of functional mental health issues, not necessarily medication that they need to take for mental health disease, but functional health issues that respond well to biochemical treatment. That could be as simple as the right nutrition for the particular problem that the child or the young adult is having to ease them without side effects. If we were running a commercial like the drug companies do, we wouldn't be able to tell you much when it came to side effects. And look out for the side effects of, oh, that's right, there are none. Some of the side effects of pharmaceutical treatment are worse than the condition they're treating. How desperate must a parent or a person be to want to take those medications that are advertised on television telling you suicidal thoughts, possible death? That is a whole lot worse than feeling depressed. And we can many times, if it's a functional issue, turn it around in as little as 72 hours. Don't suffer needlessly. It's something that can be taken care of. Well, I'm getting a little signal from Ben, my producer extraordinaire, that we're running out of time. Though this is an important subject, auto accidents and kids in crisis. Look for us next week. We're going to be on once a week talking about these subjects. I'll look forward to seeing you next week. And thank you for joining me. And Heather Klein, thank you as usual for being Heather Klein.
It was great spending time with you and great spending time with you.
Are we doing another podcast?